Hey everyone, and welcome back to the Pedia Clinic. Since heavy rains have been a normal occurrence, eventual floodings will be a sight in every street in the city. As it is inevitable not to wade the flood as to go to work or go home, we must be wary of the diseases we might contract from contaminated floodwaters. One of the common diseases is leptospirosis. What is leptospirosis? Leptospirosis is a bacterial infection that can affect both animals and humans. It's spread through contaminated water or soil, often after heavy rain or flooding. Contaminated water which enters small cuts or wound exposed to this bacterium causes these diseases. This bacterium found and spread through urine of rats, which is mixed up with floodwater. Symptoms. The symptoms of leptospirosis can be broad, making it tricky to diagnose. You might experience fever, chills, headache, muscle aches, or even vomiting. Some people get jaundice, which turns your skin and eyes yellow. Complications. Left untreated, leptospirosis can lead to serious complications like kidney or liver failure, even meningitis. Other complications include pulmonary hemorrhage. That's why it's crucial to see a doctor if you think you might be infected. Exposure. So, how does this disease spread? As mentioned earlier, animals like cows, dogs, and even rats shed the bacteria in their urine. This can contaminate water and soil, putting you at risk if you come into contact with it. Risk activities. Flooding is a major concern. Contaminated water can spread leptospirosis easily. Wading through contaminated water during heavy rains is the common risk factor for this disease. Certain occupations, such as delivery riders, septic tank cleaners, construction workers, traffic enforcers, and people whose jobs require exposure to possibly contaminated water sources, are at the greatest risk for this disease. Precaution is also needed for families who live in flood-prone areas to be extra cautious. Flooding. Prevention. How can we prevent leptospirosis? Here's how. Avoid swimming or wading in potentially contaminated water. Steer clear of contact with wild or stray animals. Wear protective clothing and shoes when working in wet environments. Wash your hands frequently, especially after being outdoors. If wading through floodwaters cannot be avoided, make sure that you do not have any open wounds or sores, which can be the entry point of the bacteria, and immediately consult a doctor for possible prophylaxis such as doxycycline. Leptospirosis might be lurking in the water, but with a little awareness and some easy precautions, you can stay safe. So, enjoy the outdoors responsibly, and remember, prevention is always the best medicine.